Ooh. Ah. Ooh. Ah. 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 Hey, what's up everybody? Welcome back to the Move Better channel. I am Dr. Joe and I'm here to give you guys a little bit more information about knee pain and the struggles that you guys might be dealing with and how to fix it. So first things first, with knee pain, one of the things that we could do is we could utilize a percussion gun or massage gun just to help us out. One of the things that it does, a percussion gun can do, is that it can activate and stimulate nerves in the muscles to help wake it up. All right. A lot of the time when we have pain, when I said before, it decreases awareness and control and activation of our quad muscles, especially when it comes to patellar tendonitis or IT band syndrome. And so one of the things that we could do is we could use a percussion gun. Simply put, I'm going to be sitting down and I'm just going to be letting it go. It could go on the highest setting, it can be on the lowest setting, whatever you prefer. Now, some people just sit here and leave it on there. That muscle is huge. We're trying to activate everything and we're trying to gain movement. And so in order to try to gain movement, we want to do what the quad normally does, which is flex and extend the knee, or in our case, the quad extends the knee. So we want to turn that on. We want to utilize the percussion gun in an activation standpoint, and we want to go on all four parts of the muscle. Right here that I'm going on right now is the vastus lateralis. Right? I don't necessarily have to go on the IT band in order to relieve IT band syndrome. I go on the vastus lateralis and I can still influence all of those areas. So I'm going to hit the side of my leg here and I'm going to go ahead and bend the knee. I'm going to straighten it again. I'm going to bend the knee. Now, if I wanted to get onto the hip area. I want to get into what we call the TFL or the latte of our hip. And we want to get into that, and notice where I'm at. I'm kind of internally rotating my hip and I want to kind of pump that. And if I'm sitting down, I want to try to internally and externally rotate my hip as I do these motions. Now for you guys, it's simple, right? You guys can just sit on a high surface like a bed if you guys have a high bed. Now if not, and if you are on the ground, it might make it actually easier. And I can just stick my foot out in that position here and then externally rotate it. Internally rotate that position and then externally rotate that hip. Now, after I've done that, I want to go into the other part of the four muscles, right? I want to go into the rectus femoris or femoris for some people that are very picky about those. I can get into that middle part of that quad, which I'm probably going to be hitting two parts of those quad muscles, which is my rectus femoris and vastus intermedius. And as I'm hitting both of that, again, I'm flexing and extending that knee as I'm sitting down. Now, another good point that I can also make is I can get it into an extended position and really open up those fibers and try to influence all the fascial tissue and the muscles in that area as I'm going up and down. Now, my shorts are kind of getting stuck there, so I'll lift this up and I'll just go up and down my quad here. I can get above my knee. Now notice, if my knee pain is here, I'm not going to put this on my knee pain. I'm going to try to get into the belly of the muscle. If I get into the belly of the muscle, it will transfer over into the tendons, okay? And then lastly, I need to get to the inner thigh, and I need to get to that little teardrop muscle, which is the VMO, the vastus medialis, what we call oblique, because the muscles run obliquely. So we want to hit those, and then we want to hit the inner thigh muscles as well. And again, going through movement here, right? And so once I hit those, see if your knee pain has already gone away. If your knee pain has gone away, perfect, awesome, you already fixed the problem. Next, if it hasn't, we want to make sure that we fix it with more, right? So, and if it has, if it is still there or if it has gone away, either way, we want to make it harder for you. We want to challenge it. Percussion guns will only go so far, whereas when we start to foam roll, when we start to stretch, we start to activate, and we start to work with patterns, that will keep the pain away. The tendonitis happened for one reason, and most of the time it's because of dysfunctional patterns and dysfunctional movement or lack of movement. We want to increase movement. The more movement we have, the less pain we will start to be in. So with a foam roller, self-massage, we can simply place our quad, we can simply place our quad on the muscle. Now, as I said, the most easy way is just simply rolling up and down. Now notice I'm kind of in a plank position, but I'm trying to make sure that my body is comfortable as possible. So I can put my hands down. This is not going to be so comfortable here. If I put my elbows down, I'll be able to sit into it and I just roll up and down. Now, if you can't see my other leg, how I'm simply on the other side, that my leg is off to the side of the foam roller. It's not directly on top of it. So that way I can kind of just control how much pressure I'm putting on the foam roller. Now going back to this side again, I'm keeping pressure on that quadricep muscle. Now I found a tender spot right here, right in the middle of the belly of the muscle. And so from here, I'm just gonna go ahead and pinch that quad by bending it. I'm putting a lot of pressure into that quadricep muscle right into the middle, and I'm just pinning and stretching it, pinning and stretching. I can reset, let go, pin as in a contracted position, and I can just pull that heel towards my butt, and that's pretty sensitive. Next, I can go ahead and lean to the side, which is called the vastus lateralis, and as I'm finding that sensitive spot there, I'm pinning and stretching that area also, and just kind of moving through the areas that I know need release, right? And then the last, I'm gonna go towards the middle of my quad, which is, I'm gonna kind of hug that foam roller. I'm getting into that vastus medialis by turning my hip. So notice, foam roller is long way. I'm gonna sit into the quad muscle. I'm gonna lift my hip up, find that tender spot, pin and stretch it, pin and stretch. Now I can also kind of scrub it out if I need to by kind of doing a little dance right here and shaking my butt and then squeezing and putting all that pressure into the areas that I need work on. Now I need to get towards the adductor, and I'm just gonna sit here and get pretty intimate with this thing and get all deep and go right into my groin area, find that tender spot. Once I found that tender spot, I'm gonna move with it, pin and stretching, trying to just work on rotation of my hip. Cool? And then lastly, if I wanted to get onto that TFL, or the belly of the muscle that attaches to the IT band, I'm gonna sit on my side, on the hip here, and I'm just gonna lean in, and instead of rolling up and down, I'm gonna go do kind of a cross friction scrubbing of that TFL rather than going up and down. Relieve pressure by keeping pressure, relieve pain, excuse me, by keeping pressure on the muscle bellies. When you push on those muscle bellies, you'll start to relieve, or you'll start to influence the nervous system, influence certain receptors on those muscles, and it will start to activate and release pain. Now that you guys have learned a little bit about releasing pressure, or at least releasing tension onto those quad muscles, really what we're doing is we're activating the nerves to increase awareness and movement to those quadricep muscles and the adductors. That's what the foam roller is gonna do. That's what the Hypervolt's gonna do. Now we have to move through it, right? And the first thing that we do, like I've always said in the past when it comes to pain, isometric contractions first. So with Matt here, what I'm gonna do is go ahead and bend this knee, nice and tight. Now I'm gonna have him hold and hug his leg here. And the first thing I'm gonna do is just try to get this quadricep muscle to lock out as much as possible, trying to make sure that his posture is nice and neutral. So he's gonna sit up as straight as he possibly can here, hugging that knee here on the side that's not affected. The affected side, the knee pain side, we're gonna go ahead and try to lock the knee out as much as possible here. And I normally tell my patients, I wanna try to have you press against my hand here with the back of your knee. Press hard, press hard, press hard. If he does that, you're gonna slowly start to see rising of the ankle off the ground. Now, if he can lock that knee, I'm already starting to create isometric contractions of that quadricep muscle, which is ultimately gonna decrease pain. Now, if pain starts to go away, we know it's the quadricep muscle. One of the things that a lot of people do is and therapists do, is they externally rotate the leg because they want to get what we call a VMO contraction. I'm going to put this out here on social media or on YouTube right now. You can't specifically fire the VMO. There's already been research and studies on there that we say, oh, hey, let's fire this teardrop only so that way we can track that knee back into place. In essence, what we're really doing is we're just trying to activate the quadricep muscle as much as possible. Now, the same nerves that activate the quads activate the same part of that VMO. And so all we're trying to do is just activate that VMO, or activate that whole quadricep muscle. When we externally rotate the leg, now we are starting to work on more adductors. So it could be that the adductors are the muscles that need a little bit more attention. And so first, once again, we did isometric contraction of that quadricep muscle. Hold it there for about a minute. Once again, placing my hand underneath his knee, he's going to try to press his knee down as much as possible and trying to lift his foot while his knee stays pressed against the floor. Then, if that doesn't fix it, we're going to go ahead and work on external rotation of the foot, locking the knee, locking the knee, locking the knee. Now, as his foot's in line with his hip, here, he's still externally rotating his foot. Now he's going to lift his leg. Ooh, that burns, huh? And you feel it going all the way into your groin muscle, right? And so now that muscle of his adductors is going all the way up into his groin area, working onto his core as well as he's lifting this up. And as if you zoom in nice and close here, he's shaking. That shit's not easy. This is an exercise that we want to try to activate so that way we decrease knee pain. Go ahead and relax, sorry. If you're not recovered by doing those exercises, there's another step that we're going to have to take. And a lot of the time that comes to what we call a closed chain exercise, where his feet are going to be on the ground. And so we're going to go ahead and do that real quick. And so what I want to do is I'm going to place this band behind his knee here, and I'm just going to pull on his knee. And all he's going to do is just simply resist me. And now you can get a band like this. You could place it around, a rig, or you could place it around a squat machine or a squat rack or something like that, or a door or a chair or something while somebody's sitting on it. And all you're going to do is put a lot of pressure against that knee, and you're just going to lock it back out. Similar to the way we were doing that open chain concept where he's working on external rotation and lifting his leg up. Now, if it's an adductor problem along with a closed chain exercise, I can simply do this. Now go ahead and lift your heel up. Now, as I pull here, now go ahead and drop your heel down and lock the knee again. That's going to work on his adductors as well as his quadricep muscles, pushing against the band and working on that rotation of what we call that femur again. And this can simply decrease that pain. Now, if I really wanted to challenge him, I'm going to have you hold onto my shoulder here, and I'm going to have you bring this leg back. There you go. And I want you to put more pressure onto this leg with less pressure on that leg. And what I can do here is now I want you to lift your heel up on this side and pull back against the band. That's it. And simply what I'm doing here is I'm trying to get his knee to lock out and work that quadricep muscle. You feeling those in the quad? Mm-hmm. It's starting to burn, right? Yep. And so I'm pushing, and he's working against resistance here in a closed chain fashion. I hope you guys like those exercises. I know it's some simple stuff, but it can help your knee pain. Make sure you try them out. Let us know how they felt. Thanks again for coming to the Move Better channel. I'm your host, Dr. Joe, and we'll see you next time.